Anyway, tell me, how can I help you?
It's Claire Harrison.
What's wrong?
She's refused to take the Ativan. She says she does not want her consciousness to be blurred.
Damn.
I'm not sure she's not right.
But when you prescribed the drug in the morning, you thought she needed it.
That's right. Yes.
Well, it's a very small dose, the bare minimum that will have any effect at all. In fact, it's not even a psychiatric dose.
But she's not a psychiatric case, is she?
So how did you persuade her to take it?
I didn't.
Now, just a minute. Let's get this clear. When you examined your patient in the morning, you came to a conscious decision that she needed Ativan.
Yes.
And yet, in spite of two qualified opinions, you decided to go by the opinion of someone totally not qualified?
Well, she may not be qualified, but she is the one who's affected.
Yes, but ours was an objective, hers a subjective decision, David.
But isn't this a case where a subjective decision would be more valid? After all, both of you are working on the same subject, her body. Only she knows much better how she feels.
Yes, but she doesn't have any idea about drugs and their effects.
Well, she can feel their effects immediately.
It comes to the same thing. She can't challenge our decisions.
She has. She's done just that. She's refused to get her consciousness blurred.
You think I don't care?
No, I think you do.
You're bloody right, I care. And so do you. That's why I took you on as my registrar. Well, look, I'm not interested in doctors who regard their patients as a collection of perambulating symptoms. Well, in her case, supine symptoms. But caring involves professional duty. We are not bleeding hearts. And the only way we can help Claire Harrison now is to maximize whatever powers she retains.
And pray, how does a depressant drug maximize her consciousness?
Well, it'll help her to use her consciousness. David, we must help her to turn her mind to the real problem she has. We must help her to accept her condition. Only then will her consciousness be of any use to her. You said that she refused the tablet, right?
That's right.
Sister Anderson?
This is Dr. Emerson.
Yes, doctor.
Please prepare a syringe with 2 milligrams of Librium for Claire Harrison.
Yes, doctor.
I'll be down myself immediately to give it to her.
Yes, doctor.
Do you want me to come?
No, it isn't necessary. You know, David, Claire Harrison is an intelligent, sensitive, and articulate woman. But don't undervalue yourself. Your first decision was the right one. Is the syringe ready, sister?
Just a minute, doctor.
No problem, take your time.
Here we go.
It's all right, I'll take it myself. I'm sure you have plenty of work to do.
Oh, there's always plenty of that.
Yes, don't I know?
Dr. Emerson, I'm afraid I must insist that you don't stick that needle into my arm.
Well, it was done and it was important.
For whom?
You.
I'm the best judge of that.
I think not.
Was that injection one of the series of measures to keep me alive?
Well, you could say that.
Then it's not important. I don't wish to stay alive anymore.
But you can't decide that.
Why not?
Because you are depressed.
Is that surprising?
No, of course not. It's perfectly normal. Your body has received massive injuries. Now it takes time to come to an acceptance of the new situation.
Dr. Emerson, I want to make something very clear at this point of time. I'm refusing you permission to give me any kind of sedation or tranquilizers.
Please, Claire, rely on us. Well, it's quite understandable. You are depressed. It's just a stage you're going to have to go through.
How do I get anyone to listen to me in this place?
Now try and get some sleep, and I'll send someone along in the morning to have a chat with you.
How do I get anyone to listen to me?
Good morning, Claire.
Good morning, sister.
How are you this morning?
Marvelous.
The night nurse said you slept well.
I had some help, remember?
Your eyes look bright this morning.
I've been thinking.
You do too much of that.
What other activity would you suggest? Jogging, maybe? I'll tell you what. Just leave me alone with John for a few hours, and you'll see what he can do for me.
I'm a sister, not a madam.
That is correct. You know, sister, as I've been saying, I've been thinking. If I'm going to be around for some time, money would help.
It usually does.
Do you remember that solicitor who visited us a few months back? Mr. Hill, I think he was. He said he'd come back when I felt better. Do you think you could call him and ask him to come as soon as possible? I'd feel more secure if my insurance claim got settled.
Sounds like a good idea.
Will you call him?
Yes, of course I will. Now, back to the spread. Come on, nurse. Back with the sheet and forward. That's better. Are you comfortable now?
Well, there's a wrinkle down there which is driving me crazy.
Now, do you have Mr. Hill's number?
He left a card. I think it's in my drawer. I'm sorry, I haven't been able to tidy up. I'm run off my feet in this hospital. Are you qualified to scratch noses?
Of course.
Do you want to give this one a go? Down south, up north, to the west, to the east. Lovely.
Here it is. Henry Hill, solicitor. I'll call him.
Thank you so much, sister.
Now, Claire, there is a Mrs. Boyle to see you.
Mrs. Boyle? Who's that?
A very nice woman.
Oh, God! Must I?
Dr. Emerson has asked her to stop by.
Then I must see her. If I refuse, he'll probably dissolve her in water and inject her into me.
I'll see you later.
Good morning, sister.
Good morning.
I'm Margaret Boyle.
Yes, right.
I'm here to see Claire Harrison.
Absolutely. That way, please. Thank you.
Claire Harrison?
I used to be.
I'm Margaret Boyle.
And you've come to cheer me up.
I wouldn't put it like that.
How would you put it?
I've come to see if I could help you.
Yes, you can.
How?
Go and tell Dr. Frankenstein that he has successfully created his monster. And now it's time to let it go.
Oh, Dr. Emerson. He's a first-rate physician, you know. Oh my goodness. They've really improved this room.
Have they?
Yes. It used to be really dismal, you know. All hospital beige and blue. It's amazing what pastel colors can do, isn't it?
Isn't it? It's astonishing what pastel colors can
Yes,
do.
of course. It's really, really cheerful.
Yes. It's a very cheerful little room. I so love it. Perhaps they should try painting me as well. I hate to be the one thing which ruins the decor.
What on earth makes you say that? You don't ruin anything.
Yes, I know. I'm sorry. That was a little whining. But don't let me stop you.
From doing what?
What you came for, I suppose.
Oh, yeah.
What do you do? Funny stories? Conjuring tricks? A belly dance? If I had a choice, I'd love conjuring. How about levitation?
I'm afraid I left my magic wand at home.
Betty.
Dr. Emerson tells me that you don't want any more treatment.
Good.
Why good?
Because I never thought he'd hurt me.
Why not?
Because he never took any notice of me.
Well, as you can see, he did.
And he sent you.
Yes.
Perfect.
So why don't you want any more treatment?
Because I don't want to go on living this way.
Why not?
Isn't it obvious?
Not to me. I've seen many patients like you.
And they all want to live.
Usually.
Why?
Because they find a new way of life.
How?
Claire, you'll be amazed at all the things you can do with some training and a little bit of patience.
Such as?
We can't be sure yet, but you know, cybernetics, robotics, computer technology, these things have transformed so many lives. Christopher Reeves, for example, or Stephen Hawking, they are just
Magnificent.
Yes, yes.
Really fought for researcher to a cure.
Yes, yes, he did.
Hawking continued with his work which was in his head anyway, the only part of him unaffected. I salute their choices, but I'm not looking for anyone to salute mine. I only want my right to make my choices respected.
What did you do before the accident?
I taught in an art school. I was a sculptor.
Oh, I see.
Tricky one, isn't it? Now let's see. How about an electronically operated hammer and chisel or a cybernetic lump of clay?
I wouldn't be laughing if I were you.
No, I don't suppose you would be.
Let me see. Yeah, you have been assessed for occupational therapy. You could actually control a computer. You could use voice recognition software. You could even manage computer art. Of course, we are not equipped to make the best of your abilities right here, but at Downlands, where you're likely to go, they have first-class OT. Trust me.
I'm sure it is. But it's not good enough, you see. I don't intend to become the object of scientific virtuosity. You see, I've thought it over very carefully. I have a lot of time to think, you see. And I've decided that I would rather not go on with so much effort for so little result.
But Claire, how can you be sure about the results that you can achieve without even trying? Of course, you are depressed at the moment, it's natural, but your treatment is meant to help you with that.
But I don't want any more treatment.
We can't stop just like that.
Why not?
But because the hospital is supposed to save